Hi everyone, I'm Dr. Akhila, consultant fertility specialist, Sudha Hospitals, Banjara Hills, Hyderabad. Today we are going to talk about how mental health affects fertility. So we need to understand that it is actually a very vicious circle. Uh, Depression, anxiety, mood swings can lead to fertility issues. Also, women and men who are infertile can have symptoms of depression and anxiety. So it works both ways. And this is something a little difficult to cope and deal with. So we now understand that women, the couples who are unable to conceive, the psychological impact of this is quite profound. And infertility is present in almost about maybe 20% of the couples. So these kind of couples go through a lot of mental strain in terms of the treatment. Fertility treatments are usually prolonged, and some of them you need to maintain the time for taking these medicines and the number of tests that we advise. So this is not a painful procedure, but it is a little tedious. Not only is the treatment tedious and prolonged, but also financially it can be a burden on some couples. So put together, it causes a lot of mental stress. And these are some of the things that we need to talk about, discuss with your doctor, and discuss with your partner how to deal with these issues and get to a solution and how to decrease the mental stress. Psychotherapy is always available, and you can talk about it and talk to your doctor and get adequate counseling. Apart from this, the other cause for anxiety or depression associated with fertility is the chance of fertility treatment failing. The higher rates of failure in treatments related to fertility. This having gone through the entire procedure and treatment, when there is a failure, that's when it is very difficult to accept that. And in turn, these couples land up with features of anxiety and depression. Apart from it being a failure, the other important thing we need to understand is miscarriages. Miscarriages also can be a devastating experience for the couple. So these are some of the things that we need to understand and accordingly seek adequate counseling for the same. So these are some of the important aspects of how mental health can affect fertility. And like I said, it's a vicious circle. Also, infertility can cause issues like anxiety and depression. Any questions, please? So this is exactly what I was talking about. There is a question that we have, and you've been trying for 7 years. So first and foremost thing is that you need to be investigated as to what the problem is, why there are fertility issues, the semen analysis, AMH count, a scan to see the follicular count. These are the thyroid, prolactin levels, the sugar levels. These are some of the things that we need to look into and figure out what the problem is, and then go for adequate treatment. 7 years is enough time. If you were to conceive naturally, you would have by now. Now, that does not mean you cannot conceive naturally, but it only means that a little help probably is definitely required. And yeah, so you need to first understand what the problem is and work towards it to be able to be happy. So 34 years It all depends, like I said, it all depends on what your egg count is, what your AMH values are, what is the antral follicular count. It depends on this whether you need to go for a donor cycle or not. If you've already gone for an IVF, has it resulted in a failure, which is why you're trying to go for a donor egg? What is the reason for this is something that you need to know. Uh, don't getting a donor is absolutely an option that you may choose or you may reject. It all depends on how you want it to be. So how to select a good fertility center depends on majorly the number of positive results that you're getting. Also, your doctor, choosing your doctor is very important. Go for the counsel, go for your consultation and get as much information as possible. The maximum information that is available, transparency, being ethical is what we're looking at. Also, good fertility centers usually provide the patients with all the reports, even including the images of the embryos after the transfer. So once all this is established, then you can choose a good fertility center that is acceptable to the finances that you will cater for this fertility treatment. So the difference between infertile and subfertile would mean infertility typically is both fertility and subfertility typically means trying for more than 1 year of regular protected unprotected intercourse and being unable to conceive. So infertility, there are a lot of causes of infertility like tubal problems, PCO, endometriosis, and low sperm counts. These are many different other causes of infertility. Subfertility would probably mean something like a mild endometriosis or very mild decrease in the counts of the semen. These are some of the conditions that are put as subfertility rather than infertility. But typically, if you're not able to conceive within 1 year of unprotected intercourse, it is labeled as infertility. So you should first erase that concept of I'm not going to become a mother. You should keep yourself positive. Relaxation therapies, psychotherapy, um, meditation, yoga. These are some of the things that can help you overcome this fear of not being able to become pregnant. And your doctor absolutely tells you right that it is very important that we stay calm and we don't stress ourselves because that becomes a vicious circle, as I have already mentioned. So this, I have already mentioned about this failure can be a very devastating experience for the couple. It has a profound significance on mental health and it can also produce financial crisis. So whether you can go for a second cycle or not depends totally on how inclined are you towards fertility and also your finances. The second cycle also should be able to offer you more than what the first cycle has been. Like if any changes your doctor is making with regard to the protocol that we've used or the drugs that they've used, the pickup, how it is done, and the sperm selection. If any changes can be incorporated in your second cycle, it is definitely worthwhile to go for another cycle. And there is also latest advances that we have, like pre-genetic testing of the embryos or laser hatching that we can do on the embryo, and endometrial receptive array if it's a euploid embryo that has failed. So these are some of the latest technologies that are available, and a second cycle you may utilize these techniques also. So to go for a second cycle when it comes to your health definitely is acceptable, but you should just look into your finances before you can think about another cycle. So spending time alone and avoiding people technically doesn't lead to depression as long as the quality of time that you're spending alone is good. So you can do meditation, you can do yoga alone, you can listen to music. There are a lot of things that you can engage yourself with and be happy about. Avoiding people, you can just avoid the topic rather than avoiding people. If somebody asks you what are your plans for fertility or when are you getting pregnant, you can just tell them that, can we talk about this a little later or sometime later, or I don't want to talk about it. Something like that instead of avoiding people altogether. So, what I want everybody to understand is once the pregnancy is established, once you're pregnant, an IVF pregnancy and a normal pregnancy are the same. A little extra care is given for the first 3 months in terms of medicines and scans, maybe, but apart from that, it's as good as normal as a natural pregnancy, and there is nothing that you need to fear about that something might happen to the baby because it's an IVF pregnancy. Definitely not. It's as normal as a natural conception once the pregnancy is confirmed, and after the first 2 or 3 months that we take that extra care in terms of injections and medicines that we give because of the absence of a corpus luteum that is normally there in a natural pregnancy. We tend to give few more injections and medicines. Apart from that, there is nothing to be afraid of. There is no problem as such. In case you still are a little worried or anxious or depressed, you should definitely consult your physician. Talk to the other mothers who are there around you. Do some yoga, do some meditation rather than yoga. Simple yoga asanas are always allowed even in pregnancy. So these are some of the things that you need to incorporate. Thank you.